What's going on, everybody? Welcome back to my YouTube channel. My name is Dr. Eli. I have a very special video for you guys today. As you all know, I recently graduated dental school, and I have the pleasure of having Dr. Andrew Wildeman join me today in this video. We're going to be talking about everything new grad. It's definitely a pertinent video for me and people like me that just graduated dental school or are about to graduate dental school. Dr. Drew is a regional coordinator of a DSO in the Northeast region of America, so around the Mid-Atlantic region, Jersey, New York, etc. We're going to be talking about everything new grad, about salaries, finding the right position for you, etc., new graduate mistakes, everything. So if that's a video that you're looking for, definitely make sure you tune into this one. If you're new to the channel, my name is Eli, and I'm a recent graduate of Boston University Goldman School of Dental Medicine and an incoming orthodontics resident. On this channel, I make a lot of videos about my dental school journey, now shifting a little bit more into residency journey. But if you're looking for anything dentistry, whether you're a pre-dent, a dental student, or someone that's just interested in seeing a black dentist, definitely make sure you subscribe. So without further ado, I'm gonna have Dr. Drew introduce himself. Just let the people know a little bit about where you're from, where you went to undergrad, where you went to dental school, and kind of what led you to dentistry, like your journey to dentistry as a career.
Thanks for having me, Eli. Definitely appreciate you having me on here. But yeah, a little bit about me. I'm from New Jersey, from the Shore area. My parents are from Trinidad and Tobago. You know, I have no family that went to college, you know, so none of them are doctors or anything like that. I got into dentistry at around the age of 12, I would say. You know, I remember, you know, I always just wanted to kind of have a better life for like me and my family. So I remember just Google searching best jobs. This was like 2008, 2006.
Yeah.
And at that time, dentist was #1. And it since has dropped to like really low, like it's like 40. So, I mean, we could talk about that as well because a lot has changed.
Yeah.
But I'm like, all right, cool. Like this, you know, this is cool. I remember like when my teeth fell out, like cutting them open and looking into it. I always like to take things apart, work with my hands. You know, and I always liked business and the idea of being an entrepreneur. So when I was in high school, I did a pipeline program at Rutgers School of Dental Medicine. So we basically went to the school every month for like the whole year, and we got to do like impressions and stuff like that. So by the age of 16, when I did that program, I was like, all right, this is definitely what I want to do. You know, I got the experience. I like got to see mentors. So yeah, and basically, I just wanted to, you know, do this. I was like, this is cool. I like working with my hands. And so from that moment on, I, you know, did well in high school, went to the University of Maryland where, you know, me and you actually met briefly. We had a lot of mutual friends, had a great time at Maryland. Yeah, and I started the US NDA chapter there with a friend Jada of mine, and, you know, just kind of grinded it out. Thankfully, did well in the DAT, got accepted to Rutgers, came back to Jersey, and yeah, man, you know, dental school is tough. You know, I'm sure you guys all watching this know. So grinded that out, did a residency at the Bronx, which, you know, was really a great program. But I actually left it 2 months early because, you know, I was doing really well, seeing a lot of patients, and, you know, just to make a long story short, I was just ready to work. Like, I was just ready to make money. I took on a job at Aspen as a managing clinical director as my first job. So I literally had no experience, and I'm like the only doctor at this office. And, you know, learned a lot there, right? Got thrown into the wolves, learned the business, like extracting teeth and knocking crowns out, getting patients cursing me out, dealing with staff that, you know, wouldn't want to listen to me, you know, front desk issues, financial things, and working with a regional manager. And, you know, I was doing well. I was able to grow the practice. But, you know, the style wasn't really for me. I didn't see myself really buying into, you know, the franchise. So I actually went to a smaller mid-sized DSO, which wasn't like a franchise model. It was more so just, you know, they acquire existing private practices and just kind of operate them, and they keep them kind of how they are. And yeah, I invested a lot of money in coaching, and case acceptance was something I learned at Aspen, and I kind of built on that with more coaching. I actually worked with like a neuro-linguistic coach with like communication and like kind of sales, and just overall learning the business of dentistry as well, and how to like make things work and how to lead a team, right? And that's something you guys all are going to have to deal with. Even if you're not the owner, even as an associate, you're going to be the leader, right? Your assistants are going to come to your front desk, are going to be asking you to make like the decisions, and you have to know how to have a professional like persona, right? You can't just be friendly with everybody, which I was in the beginning. And essentially a year in this smaller DSO, I did really well, right? So I was able to get to the milestone of 100,000 a month in production, which for you guys watching, that's kind of like a rite of passage in dentistry, especially as a general dentist. Once you cross that, it's, a lot of opportunities came, right? That's when, the clinical director of the organization and the COO reached out to me. They gave me the opportunity to be like a regional, and then also to join the clinical advisory board, where I was able to like create initiatives now with onboarding our new doctors and kind of just getting more like C-suite level experience, right? And that's also been an extra source of income for me. So, I would say I kind of know a little bit about like, DSOs, private practice, how much money you should be making, right? How much money we offer, like, new hires and stuff like that. So, that's why, I'm here now. So what I do now is I help other, young dentists and dental students kind of prepare, right? Because we don't get taught these things. And for me, I had to figure it out all on my own. I didn't have like anybody to kind of like guide me, which is probably why I went like the DSO route. I didn't have like a mom or dad to pass down a practice to me. But I've been able to figure it out, and I've invested in everything and learned a lot of things the hard way, to now where, I'm doing well, earning, probably on track to earn over 550,000 this year. And I just see a lot of kind of like new grad struggle, and I've created a platform, to basically help. And, for those that are really serious, I kind of work more one-on-one. So that was kind of a long story, but
No, yeah. I mean, very pertinent information, and we're gonna right after this, we're gonna get into talking a little bit more about your platform. But there were a few things that you mentioned that I think were super important that I just want to make sure that we touch on later. First things first, you mentioned like your journey to dentistry, and I think one thing that we all always hear about is like dentistry is a great combination of like engineering, being an artist, and being a business person. So that's definitely like, it sounds like you went right down the right path from your childhood. Another thing, we definitely got to talk about leaving the residency early. I know being from the Jersey area, I know a lot of people look into practicing in New York, and to practice in New York, you have to do a residency.
Definitely.
So we can definitely talk more about like how you felt you were ready, and when you were like at the point where it's like, man, I'm ready to just get in the field. I don't really think I need anything else out of this residency. And I think a lot of people underestimate that, if you're not interested in specializing, residency is an option.
Exactly.
And some people go in there just because, they don't necessarily know if they're ready right after school, or they don't have the mentorship that they need. And I think that this platform you created is doing a really good job at kind of bridging that gap. Because I feel like there's a lot of people that go to really good dental schools that clinically feel ready leaving dental school. However, we don't learn everything else that much. Dental schools focus a lot on teaching you the clinical skills and may prepare you excellently clinically, but we don't know about contracts very well, or where to work, what we should be looking for, etc.
Yeah, great point, Eli. And even clinically, like, you don't really know anything till you get out there in the field. But I think there is a huge gap, right? And I kind of like, I never saw myself as being a guy like to do content and stuff like this, but I just noticed such a large gap. But yeah, I'm glad you want to kind of talk about my experience in residency, because it was one of the toughest decisions I think I ever made, because I basically did 10 out of the 12 months in this program, and not for nothing, I enjoyed it, right? I got along with everyone. I didn't leave because it was like, oh, I hated it there. Like, I kind of was like the golden child. Like, I was seeing the most patients, doing the most amount of work. Like, I really just always had like a good work ethic. But they, in residency, you're still technically a student, right? And there's a lot of assignments and stuff I had to do like outside of clinical, like kind of go to the hospital and, do like checks on like HIV assessments and stuff like that. And there was like a lot of extra stuff where I just felt like, okay, I'm not really getting the clinical stuff anymore. Like I'm not getting what I thought I would get out of this program. And I had to like literally think about it, right? Because it's like essentially like I was leaving, like dropping out the program.
Good.
I started looking for jobs, and I mean, they were like telling me I was making a big mistake, and I'm gonna regret it. But I knew I wanted to work in Jersey. I didn't need the residency certificate, and I knew like, all right, if I work 2 years in Jersey, I could still get my New York license after that. So it didn't really like phase me when they were like trying to get me to stay. So I took that leap, right? And the reason I did a residency was because I was like a COVID student doctor, right? So COVID struck during my towards the end of my third year in dental school, and I was like, shoot, like none of us felt ready. Like we were the first class to do mannequin boards and stuff, and I just was like, I want to do a GPR. Like I don't feel comfortable enough. But yeah, like once even like if you do the most amazing residency program and you go into private practice, it is just still going to be a learning experience. So, looking back, I may have just probably went straight into practice. But the residency did give you like that cushion, like that safety feeling. And if you need that, you need that. Like don't force yourself to go straight to practice if you're not ready. But that was my experience there. I did a lot of endo there, so that kind of helped me. But yeah, that was my experience.
Yeah, I mean, I like that you mentioned the fact that it's like, it was a tough decision because it's still school, and with all the schooling that we go through, it's like you kind of feel institutionalized at a point.
Yeah.
And it's like, you may have felt 100% ready and still had that feeling of like, I don't want to give up on this. Because I did all this. I did 4 years of dental school. Now I did 10 months of this residency, and I only got 2 months left. But I mean, dentistry is a game of decision making, and you got to be able to make decisions and feel strong with them. So I definitely think it was very important for you to touch on that and kind of what led you to that. Yeah, so if you want to talk a little bit more about your platform and the community you've built, especially as it pertains to helping graduates kind of bridge that gap between dental school and the real world. And of course, we'll get into it a little more at the end, but you can kind of just introduce like what you started doing already.
Yeah, for sure. I appreciate that. So like you said, right, Eli, dental school, you learn how to basically treat teeth, right? But once you guys get out there into the real world, you have to learn how to treat people, right? You're not like, we really kind of like are so misled. Like, we have this idea that, wow, I'm going to be a doctor and everyone's going to just like listen to what I say. I'm going to just say you need a root canal and the patient's just going to do it. And unfortunately, that's not how it works, especially in dentistry. We deal with the most anxious patient population. I'd say the majority of our patients think that like oral health is a secondary thing, right? They always want to question it. They see us as kind of like mechanics in a way where it's like, you just want to make money off of me, right? And unfortunately, there are a few bad apples, right, where there are dentists who are pushing that patient to do the crown when they don't need the crown. And it's kind of formed this, relationship with our patients where, building trust with them and learning how to deal with people, like forget the dentistry. If you can just deal with people and the people business, you're going to have success. And even in a saturated area like Jersey, there's a lot of dentists, right? But there's not a lot of good dentists who really understand these things that I'm saying. So on my platform, I basically address this. I have a YouTube channel and my private school community, which is completely free to join. I post things on there, and I basically just have an open door policy. Like anybody can DM me, ask me questions. I have a link where you could like schedule a free consult call where I will literally answer everything for you in that 1 hour for free. And should you feel that you need more or that you want to work together, then, we could work something out. But yeah, that's what I'm really here to do, just provide as much value as possible. And I know that basically if I do that, then, I'll get, good things in return. So, yeah.
And I think it's very important, some of the things you said. Number one, we are misled in dental school. The patient population in the real world, it's not like dental school. Yeah. These are people, their money matters to them, and they only want to spend it on what they think is important. So as a dentist, you have to be able to convince your patient that they need this work, because we've seen it time and time again. Teeth and oral health in general just isn't as important to people. Exactly. And when it comes to them having to spend their own money on it, it's in one ear, out the other.
Exactly.
And we run into this situation where a lot of dental schools, dental school, just like medical school, it has a reputation of you have to be super smart to get in, etc. And, we've all been in class with those people that are brainiacs, but can't talk to a person to save their life.
Exactly.
And it's there's a lot of intangibles that come with being a good dentist. Yes, you have to be good clinically. Yes, you got to know your stuff, but this is the reason why people that come from diverse backgrounds or have a background being a waiter or working in some type of service role, they make the best dentists.
They do.
And so, yeah, they're not teaching you that in dental school, point blank period. They'd only have 4 years to teach you how to do all these clinic-based skills, and then when they throw in a little bit about, oh, this is what you need to know about insurance, this is what you need to know about contracts. But something you mentioned earlier when we were talking is you took the time to meet with someone that teaches linguistics and how to talk to people, how to relate to people. And people see us as salesmen trying to sell you stuff, and to a point we have to, but not because we're trying to make money off of you, but because we're trying to convince you that you need this work, because you do. You genuinely do.
Exactly what you're saying. It's not to you're not. I didn't learn these things to sell, right? It's your duty as the provider to make sure that you're making what you're recommending urgent. So I think that's something that a lot of us don't get in our heads. It's oh, I'm going to just tell this patient he needs a root canal, and they say, oh, it doesn't hurt, I don't need it. Why do I need? I don't want to do it right now. It's your duty to let them know this is important. You need to get this done, right? So I think for me, it's we're not salesmen, right? Because we are recommending stuff that they need, right? We're healthcare providers. But the communication stuff that I learned was, how do you make this anxious person, right? How do you basically lower their stress and not let the stress make the decisions for them? So, that's a skill, and that's something that you have to learn and communicate, right? Some people just call it, chairside manner. But, when I worked with this coach, he taught me a lot of things, sit next to your patient when you're talking to them, not across from them, because that's going to subconsciously make you feel in opposition to them. He would say, when you come in the room, try to get them to say yes 4 times. Hey, how you doing? Good weather out there, right? Yeah. Okay. How's your headrest? Is the headrest good? Cool. Mirroring your patient's kind of personality, right? If your patient's calm, you be calm. If they're more outgoing, you try to be outgoing, and they have a sense of humor. And these things are not to just make you more money, right? They will, but it's really to build a rapport with your patient. And what we don't talk about or get told, Eli, is things don't always go right. You're not gonna be out here practicing and for 20 years plus, and you never have one thing go wrong, right? So if you didn't build that trust or that connection with your patient, and your patient does think, hey, this guy just is trying to sell me something, or he just came in the room and told me I needed a root canal and never even told me what to expect, told me the complications. Well, guess what? You just did a root canal, and 2 years later, it blew up on him. Now you have a target on your back. Now you basically destroyed that relationship, and patients will come after you. They will sue you. You know, I know we're going to talk about that in this as well, but that's a real thing, man. And it's like, it's not just about getting the treatment acceptance and selling that crown. It's about building a real connection, showing that you're the authority, and gaining their trust and respect.
Because, people will always remember how you treat them. And I feel like an underrated thing about being a good dentist and a good people person is, say you're practicing and something does go wrong. You give someone a crown, it pops off, whatever. If you establish that patient relationship, establish that rapport with the patient, they'll come back to you to get it redone. Exactly. But if they don't like you, they're going to go down the street to another dentist. They're going to shit talk you when you're there. And it's like, this travels a long way. Most dentists, like, you get your patients off of referrals. And people are always going to go tell their friend, you should go to this dentist. I love him. He's so kind. He treats me so well. They're not going to say, oh, you should go to this dentist. He does great crowns. They really don't even know the difference, honestly. But they're going to be like, he sits there and he listens. He knows what you want. He knows how to make you feel good. And like, every time I leave there, I feel great. I don't feel anxious like I did at the other dentist I went to when I was a teenager. Because these things follow people for life. Like, they have one bad experience with the pediatric dentist when they're 7 years old, and they hate dentists for the rest of their life. So these things matter. But yeah, we're going to get a little bit more into the nitty gritty, talking about like your credentials and your role at the DSO, because I know we started getting into that when we were talking about what you started doing after residency. So we can definitely talk about when you were leaving residency and like kind of what led you down to choosing Aspen Dental over maybe some other job offers you may have had, or maybe some private practice roles that you were looking into, and kind of how you chose that role as like what was best for you at the time. Cool. So we can move into talking a little bit more about what you did as soon as you left the residency. I know you mentioned you were working at Aspen Dental. We could talk a little bit more about your decision to choose that DSO versus other DSOs, or maybe private practice. And kind of just how your experience was your first year working out of residency.
Yeah, for sure. So my decision to go to Aspen was, like I said, so I was basically, 10 months into residency. I was ready to leave. I was looking around. I did have like a friend who knew someone who opened up like Aspen in Jersey, because it was kind of like a new thing. There was only like 6 offices in Jersey at that time. And I got in contact with them, and, what really kind of made me take on the role was that it was probably the only situation where I was going to be getting like a managing clinical director role. So they basically offered me like the managing clinical director role, which at Aspen means basically you're like the lead dentist of a practice, and you get like a higher percentage bonus. And just the opportunity to learn the business, right? Because like I told you, I always was interested in like entrepreneurship. And, I spent a lot of time in dental school, even like reading like, personal development books, business books. So I always kind of was like, it kind of turned, like it was something that was attractive to me, right? Like, all right, I'm just going to go straight in. I could like make decisions and like be this guy in charge. Like, this is cool. So I took that on, and, I would say that like I was earning, within the year, I was earning definitely more than like the average person that was just coming right out of, residency. I think I was probably made about like 200, 250. So it was good, right? I was like used to the residency salary. So it was like once those checks started coming in, it was like, exactly. And I had no idea like what a good contract was, right? Because I saw like I got other offers from like a private practice, and they also like had a signing bonus because this location was kind of like in a rural part of Jersey, so that was nice too. So I was like, wow, this is really nice. I'm like in charge. Like they had a really good like onboarding program, and I'm not here to knock it. I think that it was a great like learning experience. Like that was the real residency for me of like the business of dentistry. They have really tight systems, and you get to learn like metrics, right? Like so as the MCD, I basically was like learning metrics. Like I was learning case acceptance rate, like total treatment acceptance, the deposits, like how much hygiene was making, how much my surgeon was making, like how many new patients are coming in per month, what was our satisfaction score, right? So I got to see how a number correlated to like behaviors in the office, right? Like the percentage of credit apps that the front desk was completing, right? So that is telling me, all right, are we giving patients financing options? Is that why they're not coming in? And, you know, that kind of just opened my mind to like, oh, wow, this is like cool, right? And eventually it just got to a point though, because, you know, Aspen is kind of, you know, it's more surgical based. So I did a lot of extractions, a lot of surgical extractions, which I liked. But, you know, I kind of was missing that like private practice like feel of like having kind of more autonomy and not just like being able to practice how I want to, not like someone telling me like this is what we got to do, or like, you know. So I eventually kind of just was over it. I left and I found like the DSO that I'm at now, and I cut back time, right? I went to like 4 days from 5 days a week, and I was like, wow, this is like chill, like 4 days, you know. I get 3-day weekends, and I kind of was like just kind of trying to recharge myself, get back into it. But then eventually it like, I got into this system and I was like, all right, I kind of pulling what I learned from this other place as far as like the business and stuff, and they didn't have all that kind of stuff like going.
Yeah.
So, you know, I would see my numbers and I knew like, okay, like I'm going to work with my front desk. Hey, let's sit down. I knew how to lead a team. I was already used to doing huddles with my assistants. I was already used to firing assistants, like finding good assistants, training them myself, dealing with like crazy patient situations where I have to refund money. You know, I remember one time like I had like burnt this patient's lip doing endo.
Yeah.
And he already was super anxious, and he liked me. The parents liked me, and like I was doing this endo. I went to obturate it, and like my assistant kind of like moved the patient a little bit, and it kind of burned his lip. And the parents came in the next day, and like I'm like the guy at the practice. I'm the only doctor there, and I had to like kind of just deal with that. They're like ready to like kind of curse me out.
Yeah.
And in that moment, I really learned like the power of just honesty and humility, right? I didn't go say, oh, you know, this happens. I said, look, I understand. This hurts me just as much as it hurts him. You know, unfortunately, these things happen. I you know, don't want to make it seem like, you know, I'm being like disingenuous and stuff like that. And anyway, the mom ended up being my patient after that. But
Solid.
yeah, I think that's, you know, I came to this DSO I'm at now, right? And then once I started to apply those kind of business kind of lessons, I guess you would call it, that I learned, and I started to invest in coaching, that's when I really started to rev up, right? And then like the opportunities came. Like once I started to get to like that 100,000 a month goal, it was like it was over. You know what I mean? It was like after that, it's kind of just been like I don't remember the last time I did under 100,000, right? And just now I'm kind of even more involved with like the business, and then getting the opportunity to go to more of a leadership level, and then kind of soaking up game on that level, right? Like, okay, like what are these people now at the C-suite level? What are the conversations they're having? Having the opportunity myself to create an initiative that we're rolling out to all our practices, and then kind of seeing the more backdoor stuff behind that and like the private equity side of it. So yeah.
Yeah, I find it really interesting how you mentioned like that year at Aspen that you did was like a residency, but in the sense of like learning the business, right? Because again, another thing that you don't learn really at all in dental school is like the business side of things. I mean, you might learn, I think the business side that they teach you is how to be an associate. But when you were at Aspen, you were learning how to be the head of the practice, which, like you said, regardless of whether you're the owner or the associate, you're the leader of a team. Exactly. And you have to be in charge of hygienists, assistants, front desk, all that stuff. And I think it is very important that you are learning things like the case acceptance rate, satisfaction rates, etc., because obviously it's helped you a lot in your
Yep.
next role and eventually becoming this regional manager of the DSO. Like, these are things that you would have had to know already to even be propelled into that role. So
Exactly.
I think it's very important, like you said, like knowing what's right for you. Like you said, you had to make that tough decision of leaving the GPR at Bronx Health, but it seems like, you know, your steps were ordered and
Yeah,
things worked out the way that they were
yeah,
supposed to.
definitely. It fell into place, and you know, I'm not here to be like the DSO guy, like you know, because everybody's situation is different, right? But you know, I have been able to see like different models, and you know, I kind of understand how they all work. So for me, the reason why I went with like a DSO was just because there's things like DSOs do well, and there's things like they don't do well, right? So the things that they do well is they have capital, right? So they can give you a lot of perks like signing bonuses, 401k match. They can, you know, PTO in some cases, and there's really like they're covering all the overhead, right, and the hiring and stuff like that. However, you are at the mercy of like your regional manager. Um, if there's something they want to roll out, if there's a new technology that they decide is best for the overall company, you have to basically go along with it, right? Now, this also is the same at a private practice because essentially if you're working with a private practice at a private practice, um, I think people like hear DSO and they're like, oh my gosh, like they're gonna be just like forcing you to do X, Y, Z. Which in some cases, yeah, like they are gonna do that, right? They're gonna be they're all about the bottom line. But what makes you think that like a private practice owner doesn't have to be profitable too? Like,
Exactly.
what makes you think that the guy who actually is paying the bills, like, and like your check is coming out of his pocket, what makes you think that he's not going to be on you or try to take stuff from you, or you know, he doesn't have the capital, right? Everything's on him. He has to do his taxes. He has to pay the light bill. If something goes wrong, it's on him. You know, and that's the person that you have to trust to do your bookkeeping. So you do hear horror stories there as well, but you know, in some cases, if you are able to get a great mentor, um, you know, and they have a successful practice and they have enough patients and they're willing to train you, that's a great situation. You know what I'm saying? And I think if you have that opportunity, you know, it's a privilege. And maybe one day you either buy the practice from them or you open up your own practice. But um, I kind of like tell all of my like, you know, community or the clients I work with, like I know that that's not the majority situation, right? You know, you may follow like dental nachos and stuff, and they post these jobs of like, hey, dentist opportunity making 500K in such and such area, and it does exist, but
Yeah.
it's like out of the 50 people applying for it, you know, like not everyone's going to have that opportunity. So what I more so kind of emphasize, it doesn't really matter where you go, but what you do when you're there and how to basically just be successful and make a name for yourself, right? So whether you like it or not, the day you got your degree, Dr. Eli, right? Dr. Andrew, you're a brand.
Yeah.
And no matter what is on that front door of the office you're at, patients are coming to see you. And not and your colleagues and peers, and they're going to know your name and your reputation is going to be attached to that, right? So one thing you need to understand is like protect it with your life. So like literally every encounter with the staff member, with the patient, like always have that in the back of your head. Like your name is always on the line. Like as soon as your name is ruined, you're pretty much done in this type of field, right? It's like, oh yeah, Dr. So and so butchered me, or he was weird with the assistant, or you know, like you don't these the word spreads fast, and you don't really want to have that reputation. Um, and once you figure out how to be successful, you know, build a following, get you know, produce, you're like you're good, right? Like the analogy I try to tell you was like the NBA. It's like, okay, you graduated, you're now in the NBA, okay, but what are you going to do from here, right? You can go and be a LeBron. You can go be Steph Curry, right? Or you could just be the person who just was in the league and is getting the minimum payment, and no one really knows who they are. But you're at the mercy of like luck, pretty much. Whereas if you can figure out how to be successful, you're going to have leverage anywhere, right?
Yeah.
Like if I wanted to go into private practice now, I could say, hey, look, I have this experience. I produce 1.5 million. I've overseen 5 offices that do 7-8 million a year. Like they're gonna take, like, you know what I mean? I'm gonna
Yeah.
have leverage in any situation. I can negotiate my contract, which I have, right? So yeah, I don't want to keep
No,
going on,
yeah, definitely. So while we're on the topic of that, like leverage and how to get the most out of a DSO, right? As new grads, how do we leverage ourselves? So, coming out of school, like you mentioned, you don't really know much. I mean, you might feel confident doing simple extractions, anterior endo. I mean, like, yeah, you can do fillings, but like, I mean, you did fillings for 4 years in dental school. If you went to a good dental school, they started you off in the sim lab in your first year. You know what I mean? So it's like, how do you leverage yourself as a new grad or someone that's a few years out of school where you can negotiate that, okay, I want 35% of adjusted production, or I want 45% because I know I'm going to bring you a whole bunch of money because I can do molar endo confidently, or I can do surgical extractions confidently. And I know, like, some people, their schools really harp on documenting your cases, doing case presentations, etc. And someone like you and me who are a little more savvy with like social media, like we know how much these things matter. But as someone that's just like, just graduated, I got that degree in hand, I'm ready to work. What do I do? Like, how do I get some good money coming out of school?
great question, Eli. And the first thing you need to understand when you just graduate is, you don't have the leverage. like you have to earn it, because you have literally no you haven't produced anything, right? So what can you do to leverage or get the most? It's going to be the same. Like, I hate to keep using sports reference, but it's like when they do the NBA draft, it's like, okay, they're going to look at, all right, what type of person were you in dental school? But really what they're going to be looking at is like, how do you present yourself? Like, your resume is all cool. Like, yeah, you got a 4.0 in, anatomy. They're not going to care about that because now, like I said, you're in the people business. So the best thing I can say to you is when you're coming out, there's going to be a range of things they're going to offer. So, I mean, we could just get into numbers now, but you can expect as a general dentist, 500 to 800 daily guaranteed minimum. Now, depending on where you're at, that's different. Sometimes that's only for 6 months, and then you strictly paid on a percentage of collections or a percentage of adjusted production. So those of you that don't know, collection is how much money they actually collected from the procedure and when insurance pays. And insurance don't always pay the same day. And production is basically the value of that treatment you did. So if I do a crown for $1,000, the insurance only paid $500. I'm only going to get a percentage of the $500. Adjusted production would be, pretty much I'll get close to the percentage of the $1,000. So now in, private practice settings or smaller DSOs, you're going to have a daily minimum just because, it's going to take you 6 months to kind of build a following. So what you can do is you have to present yourself well. And I've actually worked with some clients in my community, just like how to properly interview, what things to say, let them know your goals. Like if you're already able to say, hey, I'm a general dentist, I just graduated, I'm really passionate about, case acceptance and building rapport with my patients. I have a goal that I want to, in 1 year, I want to be making $100,000 per month, and asking them, what can you do to set me up to do that? Do you guys have the patient population for that? How many new patients? So basically you are not just getting interviewed, but interviewing them, right? And when you're able to present well, they're going to, give you the most they can before you actually get on the books and can start like showing your numbers, right? It's like,
Yeah.
you have to get out there on the court and put up the stats on your stat sheet, and then it's like, all right, cool, like your rookie year was crazy, like, you know, we want to give you the $50 million contract now. But by presenting well, by showing that you know what you're talking about, they will give you the maximum, right? So when I left my first job to my second DSO, the range for a daily minimum was like 500 to like 800, right? They were telling me like that, like when they were basically giving me the interview, and it was like 30 to 33%. And now that's also standard for like smaller DSOs and private practice. You can expect like 30 to 35%. Something like an Aspen is different because they do like a profit share system. So the way the profit share system works is you always will get a daily minimum, regardless if you produced enough to like earn that or not. But whatever you produce past your daily minimum, you'll get a percentage of what the office profited as a whole, not just what you made. So it's usually a smaller percentage than that 30 to 32% that I told you. So the idea is that they're encouraging you to not just be successful yourself, but make your hygienist busy, you know, make your surgeon busy. So that way, like, you know, the idea is to make everyone contribute to the, you know, collections and the production. And then you get a small, so you get like a check for a bonus for that month, right? So, you know, that's like a separate situation. But for the most part, standard, like smaller DSO, private practice, you're looking at anywhere from 30 to 35% of either collections or production. Don't, you know, don't go out there thinking you're going to get like production right away. It's not really out there. And if they do, sometimes they sell you like adjusted production, which ends up being kind of close to collections. So, you know, that's something you want to ask about too is, you know, what is the collections rate that you guys have? And yeah, so I guess to answer your question, you know, I went off on a tangent, but yeah, you want to present well. You want to know what you're talking about. And having already, you know, this insight that I'm giving you guys on this call, you're going to go into that interview because they're interviewing a bunch of new grads, right? So it's not like you're the only one. So what they're saying is like, okay, wow, this guy, like he, you know, or girl, they seem like they can be a leader. Like I would be their patient. You know, they're humble too, and that's something I think. You know, I've had a new associate that we had worked with, and she really came in like super cocky that like she knew everything. Like, and I was literally giving her a red carpet. Like, look, we're here to train you. I have like older docs that are willing to help. And she's like, oh no, I don't need that. Like, why are they making me do these like mentor calls? And you know, she would do like molar endo and perfect tooth and then be like, oh, I'm going to have them come back. And I'm just like, what? Like,
Yeah.
you know what I'm saying? It's
Yes.
so don't, you want to be humble. You want to say, look, I just got out of
be
dental school. I can do
coachable.
these procedures. I want to learn. Okay. If you guys can invest and give me the tools and resources, I want to learn how to do molar endo. I want to eventually place implants. You know, and yeah, I'm willing to learn.
Yeah. Yeah, super important. I think there's value in knowing what you know and what you don't know. And you know, everyone wants to present with some degree of confidence. It's important to be confident as a dentist in what you can do and what you bring to an office. But you do have to understand that 10 times out of 10 as a new grad, whoever you're interviewing with, they've been in your shoes, they know how it goes, they've seen it happen time and time again. And I think another thing that you mentioned is super important because this is the advice that I give to pre-dents all the time is when you're going into an office to be interviewed, like that's your chance to feel out the office too. Same way as dental school interviews. Like we go into dental school interviews and we're like, okay, I just want to look the best that I can so I can get into this dental school. But I mean, I've been in this situation myself where it's like, okay, I got a dental school interview. For me, I applied during the height of COVID, so there was no going in person. I'm sitting on Zoom with someone, and I'm like, man, I don't like this vibe. And if you don't like the vibe in the interview, it's not going to get better during your 4 years of school.
Exactly.
So it's like you got to know where you fit in, what feels best for you. And I mean, when it comes to offices, like this is your life. Everyone that, especially if you've been on a non-traditional pre-dental journey, you know from working in the real world, like you spend more time at work than you do at home, than you do with your family. Like the people you work with, the place that you work at, it matters. even small things like how far the office is from your house, how much time you're going to spend commuting
Sure.
in traffic. Like these things matter. Um, and you
Yeah.
know, we come out of dental school and we're going from $0 to whatever they're offering us. So it's quick for us to jump out at an opportunity, but you really got to know where you fit in and what's best for you. So yeah, so that's the advice that I give to pre-dents. And then, you know, as you navigate through dental school and you're trying to figure out if you want to work or do residency or whatever, it definitely became even more pertinent for me, like with the match process, because when you're applying for residencies and you're going through this match process, you got to pretty much rank everywhere you interviewed from what you like the most to what you like the least. So it's no longer a situation of, okay, I'm interviewing here and I just want to get in. It's more like, okay, I really got to feel these programs out, because it's not really like a, oh, I'm going to know everywhere I get in and then I'll have my pick. I have to know which one I like the most before I even know whether I get in or not.
Exactly.
And so when I was applying for residency, like I took the opportunity to go shadow at some programs and like just kind of feel them out before I even applied. Because when you're in dental school, you're past broke. You don't have the money to apply to just every program in the nation. So
Exactly.
that's the way that I was kind of like feeling out places and wanting to know if I would even put my money towards applying to the program. So I was kind of wondering like what advice would you have for dental students that are kind of looking for their next position when they come out of dental school?
Yeah, that's great. I think the first piece of advice is to do what kind of you said, right? Start early. You going out to shadow like your residency programs, before you even thought about applying is like that's what you should be doing. If you feel like you're going to be um, going into practice, right? And even when you go into like your ortho practice, right? You should, before the um, end of your program, you should be going to shadow practices, right? And you're going to even have more leverage because you're already basically a doctor and you're already about to get your ortho, uh, you know, residency completed. So they're going to be looking to hire, right? So the earlier you are in the process, the better it's going to be. And you're going to be able to feel out the offices. And like you said, offer to just shadow the doctor, especially in more private practice situations. They'd be glad to, right? Because they're going to be like, all right, like if you're spending, let's say you build rapport with the doctor um, and you're going once a month on a Saturday to help them out and just to assist for free, right? A private practice dentist would love that. Okay, so this is like a hack I'm giving you guys here. Like, go reach out to private practice dentists in your area, and reach out to them. Say that, hey, you'll assist for free on the weekends, and while you're there, you're not only going to learn, you're going to see how this practice is running. You may build a relationship and really like this person, and he might offer you an associateship. You may down the road buy the practice from him. But overall, reach out early, right? Reach out to recruiters early in DSOs because they're constantly buying and acquiring practices and building new offices, and they're going to need people. So the earlier you are in people's minds, the better opportunities you're going to have, and you're not going to be someone that's like scrambling and desperately take that bad job because you just sent out like 10 applications like a month before you graduate and you're just crossing your fingers hoping that it makes sense. Um, and then also, my second point of advice would be to think about, as a general dentist, I would say think about procedures that you want to learn or that you kind of have an interest in, right? So if you feel like I want to learn uh, implants, I'm more interested in doing extractions and surgeries, then yeah, maybe you should look at DSOs that specialize in that or give you that opportunity, right? Because certain programs and offices um, specialize in that, right? Aspen, you'll be doing a lot of extractions. They'll set you up to place implants and all that stuff. Whereas if you just applied somewhere, didn't really ask about if they even have specialists at their office. You get there and there's an oral surgeon they have. Guess what? You're not going to be doing extractions. They're not going to want you to do extractions because that's for the specialist, right? So this is something that you want to focus on. The third piece of advice I would say is to, try to build your soft skills and, you know, invest in reading books and just watching videos that are on basics of like communication and business, right? So, a couple books I would recommend. One is like How to Win Friends and Influence People by Dale Carnegie. That's a really popular book. Second one is The E-Myth by Michael Gerber. And then you can just get like a basic book on, just business, right? Or marketing. And what that's going to help you do is kind of understand to think as not just a leader, but like understanding like that you're in an operation and how to basically zoom out of your position and see how everyone else around you ties into your bottom line, right? So because I've had all this like experience in coaching, I don't just walk into my office like just focusing on my just experience with my patient in my room, right? I'm noticing everything. Okay, like when I'm having a huddle, um, what are bottlenecks that we have here? Okay, I'm noticing that like my assistant isn't doing well at this, and this one's better at this thing, right? Or my front desk isn't asking my patient if they want to do same day treatment, right? So there's so much going on in the background,
Yeah.
right? Or even your lab tech, like getting their information and texting them cases and making sure your cases come out properly. Like most dentists don't even think that they can do this. They're just sending it out. But yeah, you can. You can send them pictures, call them. So, you know, that next piece of advice is just learning how to build relationships and rapport with not just your patient, but your staff and everyone else involved and colleagues like your specialists,
Yeah.
right? So, Eli, you're going to be an orthodontist, and anybody watching this who's going into specialty, yeah, you're not going to have a problem with patients, as much as a general dentist because we're all going to be referring them to you. But you still have to have a professional demeanor, be able to explain things because specialists, you're doing things that are a lot more expensive, right? Especially something like ortho, which is, in most cases, patients just see it, oh, this is like a cosmetic thing,
Yeah.
right? So you have to get them to understand the benefits, not just cosmetically, but, the other benefits, and communicate what they're getting for their value. And then also driving home the importance of them doing their due diligence at home, wearing their retainers and just, you know, being someone that builds a good name for yourself, you know, and yeah, so I think those are the main things that I would like advise, residents or new grad.
And I think it's there's a few things that you said in there that I think are very important. Number one, like these hacks and like this free game that you're giving, like I need people to understand like there's real value in this community that you're creating, whether it's for dental students, residents, or even dentists that are like already in the field and just still trying to figure things out. I think that there are specialists out there that kind of just like, oh well, I mean, you're a general dentist, like I don't need to hear what you gotta say or whatever. But it's like, bro, like these things matter a lot. And to some people, like they just don't understand. I think like when you were talking about like the books that you read, one thing that I like just popped up in my mind is like the people in this world, like not in dentistry, just in this world, the people that make a lot of money, they think differently than most people. Like I know like right now, because as much as I love dentistry, like I love the social media and all that stuff, I pay a lot of attention to what Kai Cenat does because there's a reason why he's so like popular. He's smart. This man has ideas on ideas. Exactly.
Right? And that's great, Eli. And I think, I'm excited to see your journey, man. Like you're going to be extremely successful. I think that, you don't even understand it yourself yet, but you're already asking the right questions. You've built something already here for yourself, and you are thinking different already. So it's like, dude, once you get out there, like enjoy this process, enjoy this next 2 years, man. Because listen, certain things will never be the same. Like you're gonna be living a totally different life. So yeah, it's people think different, right? And One of the things I'll point out in the book, the E-Myth, that kind of got me to think different is, the book just basically talks about the entrepreneurial myth, which is one, just because you're good at something means that you're going to be good in the business of that thing, which is applies to dentistry. Just because you know how to do every procedure flawlessly, that doesn't mean you're going to like be successful in the business of it. And then the second thing is just because you own a business, that doesn't make you an entrepreneur, right? And there's three parts to being to the entrepreneurial mind. So there's three levels. You have the technician, which is the person just doing the work. You have manager, which oversees that person doing the work, and then you have the entrepreneur, which is at the top level. So the technician is, let's just say, okay, the associate, right? You're there working, associate. The technician is just focused day to day. Okay, I come in today. All right, what's on my schedule today? All right, cool. Is today going to be a good day, bad day? Oh, today was busy. Yesterday was slow, right? Manager, right? Any type of industry you're in, the manager, they usually think quarterly, right? They have quarterly reports, quarterly meetings. They're kind of zoomed out and they're overseeing the associates. So maybe someone like myself, a regional dental director, I'm seeing all the associates' numbers, seeing which ones are causing issues, what issues they're having, how I can put out their fires. Thinking about, okay, long term, all right, what are our annual goals? And then you have the entrepreneur, which is usually the CEO, and they're thinking way further down the line. They're thinking big picture themes that take 4 to 5 years to roll out. And for you to be successful, you have to move up those ranks, right? So when I was at Aspen or when I was in the residency, I was a technician, right? Then Aspen taught me the manager. And then now I'm kind of thinking like an entrepreneur, right? Because now I'm not just like the patient interactions and case acceptance is on autopilot for me now, right? Yeah. Now I'm thinking about, I'm having meetings with front desk, right? And I'm saying, guys, look, we need to refine our systems here. This is how we're going to do things now. These are the follow-up systems we're going to do. I'm printing reports and I'm saying, look, here, we're going to assign this girl, your strengths aren't really in front desk greeting people. I'm going to put you over here. You're going to basically just do pre-auths, okay? I'm going to print this thing out. You're going to highlight, all right, all these patients on this insurance. You're going to follow up, and you're just going to try to fill my schedule, right? So I did that, and that led me to have, like, record months. But thinking different and being able to kind of ascend up that ladder and up that pyramid, that's what's going to really be able to give you success. And I guess what I'm trying to do is, by me investing in coaching, one of the coaches that I had, Dr. Katie Lee, who she's a titan in the space. Like she was voted 30 under 30 in Sizewell Edge magazine. Does consulting for my DSO, which is how I met her. Owns like a practice that is also like a medical dental practice. Works with oral, saliva testing company. And she's the chief dental officer of a private equity firm that invests in dental software. And dude, I paid, thousands of dollars for like 4 phone calls a month, but it's like, I'm getting that bird's eye view, right? Yeah. How do I pitch a proposal to my CEO for a whole program that I want to roll out, right? So I'm kind of just trying to do that with my platform, is just giving you guys these bird's eye view insight, like, yo, dude, like, come up here, man, look from down here. Like, because if you can see this view, everything's going to be so much easier for you.
Yeah. And I was just, two things, shameless plug. They featured me in that in Sizewell Edge magazine as well. They did like 10 influencers, dental student influencers to watch type of thing. And they featured me in the summer issue last year or something like that.
That's one of many, man.
Yeah,
I'm sure
man.
You're going to be featured like so many more times. So
I got big dreams,
man.
man.
Like I said, I really am excited for you, bro. Like, I think you're gonna really do great things, man. And it's like, I love being like here now. You get what I'm saying? Like, I love connecting with you now and having like met you like at Maryland, man, and like seeing the journey. It's gonna be special. So you're just getting started, man. Like, trust me.
There was another thing I was gonna ask is, do you let pre-dental students in your community?
Definitely. Those are probably like, the favorite students I have, because I just see myself in them, and they really have no idea what to expect. And you could prevent a lot of like headache, right? You know, one of my actual more recent clients that I actually worked with, like one-on-one coaching, she actually was like my classmate.
Oh
And
yeah.
yeah, yeah. And you know, we talked about like a lot of things, and you know, it's so crazy, man. It's like you said, like the how you get institutionalized and you get indoctrinated into certain things, and you don't even know certain things are possible, right? Like, you know, I remember like doing extractions early on. I thought I had to get the whole tooth out with the root tip, and sometimes you're there with a patient 2 hours trying to get it out, or you cause damage. And it's like no one really said, dude, just put some bone graft, you know, and then get it to a specialist. Or, you know, what her problem was having was, you know, in our first free call, I gave her this like nugget that made her more money instantly, but she was doing endo on patients, and she didn't know it was possible to do like the post-core crown like in the same visit.
Yeah.
And you know, and then she was like doing things like packing cord and like doing a lot of accessory things that don't really even have clinical significance. Like unless you're doing a crazy like veneer case. But I was just like, doc, like listen, why are you like take 30 more minutes, right? Do the post-core crown. After you already drilled the tooth, the patient's already numb, you did the endo, build up the tooth and prep it, right? That's going to be another $800 to $1,500 added to your day, right? So if you're doing that with every patient that you do endo on, you're going to make $20,000, $30,000, $40,000 more a month in production, which is going to be $10K a month. You know what I'm saying? But it's just all because like they're just practicing a certain way. They're not thinking about efficiency, right?
You know, same thing we were talking about. Like, dental school doesn't necessarily mimic the real world. You got people coming in, at least at my school, like we do prep and temp in one visit, final impression in another visit, then delivery in the next visit, where it's like,
The
bro,
real world is
one,
different.
I learned quickly on externship, you don't need all that time, bro.
Yeah.
Do the prep and scan it. Like,
Patient would even want that too. And that's something I talked to her about. I'm like, you know, she's like, oh, I'm like, look, if you were a patient, do you want to come in 3 times for one tooth? You know, these people have lives, they have a job. You know, part of what you're doing as a provider is not just being nice to them and getting them to trust you, but you got to like be efficient. And it's not just so that you can make more and do more, but for your patient too. Like, it's not a good patient experience if I'm sitting in a chair for 3 hours and then I have to come back again. No, you know what I mean? Like, you want to be efficient. You know, something I also tell them too is like, you don't need 20 burrs on your burr block. Like,
facts.
like pick
You're
your like
sitting there
6 favorite
digging,
burrs.
you're looking through
You
your
know?
loops trying to see which burrs, which one. Like, you're
Because
wasting
guess what
time.
happens? Like when you're out here working with assistants, it's like they're gonna like this 20 burr setup you have. They're gonna forget the main burr that you really want.
Yeah.
Like, you know, so it just makes it easier for your assistants too, right? And that goes back to my tip about building that rapport and zooming out and understanding everybody's role, right? So, you know, even getting the most out of my assistants, I was struggling early on. Like, all right, why are they like, dude? They don't want to work hard. They're human. Like they aren't getting paid on production like you.
Yeah.
So they want an easy day. Okay, so how can you get the most out of them? All right, well, this is what they really value the most. They want to get out early for lunch, and they want to get out early at the end of the day. Okay, so if you're able to do that, you can make them as busy as you want. You know, so yeah, just those are a couple of the things that I recently talked about with her.
But another thing, like you were mentioning, and especially because there's obviously thousands of pre-dents that watch this channel.
Yeah.
Please, if you're watching this video, please join this community. What we just harped on is thinking for the people in this world that make money. They think ahead. If you're a pre-dent, you should be thinking about after dental school now, because before this video even comes out, I just recently made a video that I finished editing today that I'm putting out soon, which is like how to pick the right dental schools to apply to and to attend. And I feel like, you know, I switched from pre-med to pre-dent like a year before I applied to dental school. So I didn't know too much, And I got lucky where I found a school that we got CEREC scanners in every bay in the clinic. So I'm learning how to do digital crowns. Our school lets us place implants pre-doc. And then for someone like me, like I had the feeling that I wanted to go into ortho going into dental school, but like how lucky was I that I got to take on Invisalign cases in pre-doc. Even if you don't want to go into ortho, as a
That's so
general
valuable.
dentist, that's making you so much money in like
Yeah,
Made the
little
right
chair
choice.
time.
going
Going
to
to
dental
dental
instead of
instead of
medical.
medical.
You,
You know,
yeah, facts. Oh yeah, I knew that as soon as I switched.
you would have had a 2 more year residency. Uh, 4 to 8 years more being a broke like resident, and you still come out making less than an orthodontist.
Exactly. And it's like, just as a pre-dent in general, like these things that Dr. Drew is giving out in his community, they're going to matter. They may not matter to you right now, or you may not think they matter to you right now, but trust me, if you're getting ahead on this, you're going to come out making more than all your classmates. Like, and at the end of the day, like, I mean, yeah, we're going to dental school because we want to take care of people, but dental school is getting more and more expensive as the time goes on. You want to set yourself up to be able to pay that debt back as quick as possible so you can live your life freely and how you want
You
to.
don't want to worry about money, right?
Yeah.
You're gonna make worse decisions, and you're gonna make worse decisions if you're going into your office every day and you're stressing about student loan bill, your rent. Um, you know, that's when stuff starts to get really cloudy. You get depressed, and not to be like dramatic, but like, I never really understood the dental like suicide rate. I was why would you want to be suicidal if you're a doctor? Like to me, like as an immigrant, like first gen, like I was like, dude, that's like the holy grail. Like, but now that I work, like, man, listen, dealing with people is not easy, especially dental patients. Like I told you, they're the most anxious patients, and they dump that onto you, right? So if you're not mentally prepared and you're going in there and like, you know, I get patients that are like coming in super scared, or like they're like, even the patient that's like maybe even aggressive, and it's just like I'm unfazed, right? Because I understand, like, I'm here to like I'm not taking anything personal, and I actually start to like make fun with them, and I kind of like could switch the situation around. But I basically just say that to say is, like Eli said, you worked hard, you invested a lot of money into your career, not to stress. Like you don't want to worry about money. You're going to be a better clinician and a better teammate when you're coming into work and you just were able to go on a vacation to Italy, and you have a nice car and a nice watch, and you don't stress about bills. You're going to really be able to really focus on the clinical things and getting the best results and being able to invest more and learn new things. So you know not for nothing, it's not all about like buying a Lamborghini and stuff like that. Like, but making money is about putting you in a situation to be your best self. So,
Yeah, facts.
What is
And
bang for the buck, man?
yeah, man. And like, I know, like, for me personally, going into residency, like, I think different now than I did going into dental school, right? Like I mentioned, I didn't know too much about, like, how important it was to learn how to do, like, digital crowns and stuff like that. But I noticed something in myself, like, man, as soon as I think it was like a week after match day, I was on Instagram. Number one, I follow every orthodontist I see on Instagram, TikTok, etc. I follow them. Maybe not because I really care what they have to say, but I want to see what I need to know, like going into residency. Because in dentistry, like you pay for these residencies. I'm not trying to pay for a whole bunch of CEs when I get out. I need to get what I'm getting out of these 2 years. And then another thing is like, it had to be before winter break. I've been seeing the Dentist on Instagram. I don't know if you've seen him on Instagram, but he has like 15 million on TikTok or whatever. And one of my line brothers, like his good friend, actually works for him, like fresh out of ortho residency, went and worked for him. I was like, yo, give me that guy's number right now. Like, it's already not that many black men in ortho as it is. Any one of them that I see, I need their number. I need to make that connection because these people can put you on game, and that's exactly what you're doing with your community as a dentist. You graduated in 2021, so like you've been out of the workforce. I mean, you've been out of school for 4 years. You did the GPR, so really you've been in the workforce for like 3 years, and there's so much value in that we as dental students, new grads, or even pre-dental students can get out of that. That it's like don't look past like the value in a community like this.
And like I said, it's completely free, right? And I just started it, so like those of you guys that get in early, like it's completely free game. And yeah, I don't want to make it seem like I have it all figured out, right? I'm still early in my career. It's like, um, you know, the craziest thing is like, so I created this initiative, right, which is onboarding new doctor onboarding, which involved us creating like a regional dental director position. And it's like, I'm on the clinical advisory board interviewing guys that are like 30, 40 years older than me, to see if they're good for the job. And, it that's something that we could talk about too. It's like, you will have a little imposter syndrome at first, because you don't know much when you just get out. And, that's something I can help you out with. But yeah, I don't claim to have it all figured out. I'm still learning myself. But the reason why I focus on dental students and new dentists is because I think, like Eli was saying, that doesn't exist. And being that I did just graduate in 2021, I think, I have a good idea of what's currently going on in the landscape. And, not for nothing, I think someone who's like 60 or 70 years old can't really provide us the insight, right? Like
The game has changed too much in general for that.
it was 30 grand total for like dental school. You know what I mean? So it's like, they were able to open up a practice for pretty much nothing and make money. And, now with insurance companies, you see dental ownership, declining. Not to say that it's not an option, but you got to get more creative. So yeah, those of you guys that join, I'm going to give you as much as I can, for being early to it.
All right, so before we wrap up the video, I just want to talk a little bit more about your personal journey, especially you being a new grad. And I know you mentioned you graduated like right after COVID, so you definitely dealt with some of the hiccups that we may or may not be fortunate enough to avoid. But what were some of the goals that you set for yourself, like coming out of that residency that kind of got you to where you are now?
Good question. To be honest, I think my initial goals had nothing to do with like making money. I think it was like I just wanted to come out and learn the business of dentistry. Just obviously, yeah, start to earn as much as I could. But when I got to the practice, my focus was just, all right, I need to know everything that's going on. And I think that, when you guys come out and you start to work, no matter if you're a specialist or a general dentist, you should see that, look, your first 2 years are kind of like another learning curve, right? Like I know you did the college, you did the, dental school and the residency, but, there's going to be another learning curve to being in the real world. So just come in ready to soak up as much as possible and work with your teammates, in the best way. So I think I came in, I was like, look, I just want to learn the business, build a relationship where everybody, like one thing I always was about was like, I always wanted to be like a source of like light to everybody. I wanted to be somebody that uplifts everyone and that kind of like just has a good like relationship. Like I want to make my place of work like a good place to work. And I think a lot of people, don't come in with that mentality. They kind of just focus on themselves. And when you do that, you're really missing out on a lot of opportunities. So, that was kind of like my initial thing. Then when I got settled, it was like, all right, like how do I grow this practice now? Like I want to take us from X number and bring us up here. You know what I mean? And how am I going to be able to do that? So after that, I would say you will notice that's part of getting from that number to this number is just being a better clinician. So after you start to just like get over the initial kind of like, uh, newbie, rookie kind of feeling, and you get a feel for the procedures you're doing. You've done a crown prep a couple of times. You work with your assistant like a couple of times. You got your kind of workflow going. Now you want to dial in and do these procedures um, as best you can. Do research. Now we have things like ChatGPT and stuff. You can just go ahead and ask questions. Like you can learn so much now that was never available before without like having to do CE, right? Watch videos on YouTube. So that was like another goal I had. And yeah, I would say that was probably like my main focuses that I had.
So what would you say were like some mistakes that you made or some things that you wish you had done differently coming out as a new grad?
Coming out, I wish I would have looked earlier for like different job positions, definitely for sure. The second thing I made a mistake on is the imposter syndrome, which I kind of brought up earlier. So something that like isn't really talked about. Some of you guys watching this may feel it more than others, but especially as like you know, you didn't have anyone in your family as a doctor. Maybe like no one in your like high school friend group, did anything, equivalent. So you come out here and you start practicing, and it's like people are calling you doctor, doctor, and then I kind of shied away from it a little bit.
Yeah.
And like it
Bro,
was
you're preaching to the choir right now. Not good.
like it took me so long to just like really stand in it and like have the authority and like I think it was I don't know, I just always was the humble guy, like, oh guys, like no, it's all good, like we're all chill, like and I spend a lot of time like talking to my staff members, like probably too much to where it was like they didn't see me as like this is Dr. Wildeman, like yo, he needs his stuff like he needs like his stuff right. He needs to be on it. Um, I was too lax because I was overcompensating for this feeling of like survivor's guilt and like, oh, I don't know if is this real? Like, did I just get lucky? And like, so that's something I made a huge mistake on. And if you're watching this and you feel like that's you, you got to understand, like, listen, you did the work. Um, you earned this, and you're the authority, right? Like people should be listening to you. If you say you want something a certain way, it's not just because you're trying to be in charge, but no, you're trying to deliver the best care. So if you want to go take that X-ray and your assistant is like being lazy or whatever, like no, say you need that X-ray. Um, you know, basically be strict as far as like what your expectations are, not like micromanaging them, but um, let everyone know, like, hey, look, and I say this now to my like staff, which I really am cool with. Like, we just went out to a bar. I bring them out every quarter. I like to do something nice for my staff, and I tell them in a huddle when things aren't going well, you have to be able to step in, right, and be that authority and say, guys, look, you know, I like to joke around, but I don't like to be a joke, right? I'm here to be excellent. And if you guys aren't on the same page, then like, you should probably look to work somewhere else, because I want to be the best. I want to work with the best. I want to make this a great experience for us to work and not just us, but for our patients. So, that was a mistake I did, was just kind of belittling myself all the time. Um, I would say another mistake I made was taking a lot of things personal, man. Like, things aren't gonna go right, and I was somebody that would like literally lose sleep over stuff. Like, like if a crown prep didn't go well or some I thought could have been better, I would really be hard on myself, especially if a patient's like telling you certain things. But listen, man, this is a part of the game, right? Like, you're gonna get fouled out there. Things are gonna happen. You gotta like not take it personal, learn from it, move forward. And then, yeah, the last thing I would say is I was not zooming out, like I told you. I was just like, if something wasn't going well, uh, I would kind of just be quick to blame it on like, oh, like something's wrong with this office. Like my staff sucks. This person sucks. So it's like there's never going to be an ideal office. Like there's no such thing where it's like everything's fairy tales. Like you're either going to have, a staff member that calls out a lot. You're going to have maybe like the not the most ideal patient population. But what you need to understand is that you do have an influence over everything, right? So for every problem that I have now, I'm just like solution based. Like, all right, what can we do to fix it? How can we make this better? Um, Even though I may not be able to get to the best, but what do we need to do? And then act on it, right? So don't just point the finger, take accountability, and don't just be like, oh yeah, this place sucks. Like, the computers here suck, or why are they trying to make us do this and that? And a lot of doctors complain, right? A lot of my doctors complain a lot. They're like, oh, I can't. How am I going to do this with like, and it's, just take accountability. And even if you're an associate, like it's like your patients that you see and your ability to earn and stuff like that, it's on you. If your front desk isn't doing something, go talk to them. Go have a conversation with your regional manager, right? And if that's not working, start to look at other positions. One thing that we have and are blessed with is there's always going to be a job you can get out here. Like the unemployment rate for dentists is so small. There's such a large turnover. Like you're always going to be able to find a job. Like you're never stuck to one place, which I think is like something that's really cool. Like if you want, you can get a license in a whole nother state. You know what I'm saying? So um, those are all things I wish I would have done better. And that's why I built a community, try to help out you know students to kind of avoid these things that I messed up with.
Yeah. I feel like you were speaking directly to me when you mentioned the imposter syndrome thing. I know as much as people don't like to admit it, like we all struggle with it or have struggled with it at some point, especially as a dental student. But I know like in my position and my classmates and other people in class with 2025 that has graduated, it's like we're still in that kind of sweet spot where we're like, damn, we graduated. Like,
Yeah, what do
but
I
it's
really
like
know?
a year ago you passed the boards, months ago you passed your licensure, you
Yep.
just got the degree, but now you're like, oh, like I'm really Dr. Such and such. And like you mentioned, like that's a brand. Everything you do is attached to your name. And I think like another important thing that you mentioned, especially like coming from backgrounds like we do, it's like we might very well might be the only doctor that we know and the only doctor in our circle. And
Okay.
people are like, yo, like that's the doctor. Like I know like now, even now, like I'm playing 2K with my friends and they're like, yo, you're really a doctor. And I go like, oh shit, damn, you're right.
Bro,
And it's like,
that there, I don't know how many times I heard that. Like, yo, you're really a doctor, and it's like, come on, man.
yeah,
Like,
it's
bro,
like,
I'm
and
trying to
like you
chill right
said,
now.
like,
Like, I'm trying to play 2K. Like,
yeah, and like you said, like it does come with like some degree of um like of course like we're humble, we don't like to be that guy, I'm the doctor, but at the same time like you said, like you shouldn't
society does
belittle
look at
yourself.
it. Yeah,
Yeah, and your accomplishments, like you shouldn't belittle them because they, as much as like to you like it's like it's just another thing, especially like you grew up in a Caribbean household just like me. It's like excellence was kind of expected already, you know what I mean? Like I was looking
right.
at pictures of my graduation today and I'm like, damn, I've never seen my parents so happy before. But it's like it's just like you really got to step back and remind yourself like you worked hard to get here. Like
Yep.
you are the doctor. People have to listen to you and they know you are the head honcho when you're in these offices and you're running these dental teams and
Yeah, and kind of sparked something in my head to say too. Like, just to build on what you're saying is when you're just working and you're coming in, like, don't like stand in it. Like, don't be just like don't just conform to like what they tell you to do. You know what I'm saying? So like you're going into ortho, right? You did your residency. You have a certain style that you like to do. Something I kind of did was like I came in and your assistant's like, oh yeah, we use this or that. It's like no, this is how I practice. You know what I mean? So don't shy away from that. But
yeah,
yeah, man, I definitely feel you. Took me a
yeah.
while to shake it off, man.
Yeah, I'm working on it. I'm like, I feel like I've been in that position now where I'm like, damn, I'm kind of happy I'm going to residency because it's like I don't have to fully step into it yet. It's like,
Yeah,
yeah,
yeah, yeah.
I'm a
You want to ease
doctor.
it.
It's like I'm in the process of applying for my Indiana license, and I'm still everything that I do in the process of applying to this license. I'm like, damn, I'm applying for my dental license right now. Like,
Oh,
there's
wow,
definitely those moments.
real man.
But all that goes to say, it's like this time comes, whether you're a pre-dental student, you're a dental student, you're a resident, like the time comes when you're going out there and you're going into practice, and the more you prepare yourself, the more ready you'll be to really set yourself up well, like just to be not only well off money wise, but to be happy. Like,
Exactly.
I know they say money doesn't buy happiness, but I'd be a lot more upset if I was broke. And I'm here
And
right now as a dental student. Like, we all been there at some point. We know how it feels. Um,
yeah, for sure, man. And the money is a consequence of you feeling good, making patients feel good, making staff feel good, being a high vibrational person. So it's like, once you just can step into this like desired life or dream life that you wanna have, and you can, instead of stop dreaming about it, you just start living as that person already. Yeah. The money comes.
yeah, and it's definitely the habits that you form, the things that you do. Like, something that you mentioned way in the beginning of the video is like you took the time to really just read some books, learn about the business, learn more about the intangibles, gain the coaches, the investing in yourself. All it is investing in yourself, honestly. And it's not always a monetary investment. Investing the
Exactly.
time in bettering yourself and like forming those habits of successful people. Successful people do certain things, and we talked about that earlier. Thinking forward, learning the skills, like these are things that you have to do if you want to be a successful person. So um yeah, I mean, this was great. I think we covered a lot
Yeah,
of
man.
good
This was
things.
awesome. This was awesome.
And I told you before we even started the call, like, yeah, we're making a video, but I feel like I'm going to be learning directly from you. And it's like the video just happens to happen as we're talking. But it's
Yeah,
like,
yeah, yeah.
I feel like I learned so much from talking to you for this last hour or so.
Yeah.
And so I want people to be able to find you. Like, what's the best way to get in contact with you, your social media, how to join your community, etc.
Um, yeah, man, this was great. I really appreciate this a lot. Yeah, you guys can find me. I have a YouTube, Dr. Wildeman, DMD. The school community that we were talking about today, which is free. I'll put the link. I'll give the link to Eli. You guys can click on that. And then you can follow me on Instagram. I don't really post that much like dental related stuff on there, but it's dr.drew.dmd. And yeah, you can follow me on there. DM me if you guys have any questions or you want like a more personal, question. So.
Cool. Yeah, so all that stuff will be in the description. Definitely make sure y'all join the community. I'm joining literally as soon as this video ends. Thank you everyone for watching. I appreciate y'all tapping into this video. Definitely some good information in this video. If you feel like you learned something new, definitely leave a comment under this video so we could talk a little bit more about it. And make sure y'all go follow Dr. Drew. I know, like he said, he doesn't post too much dental content, but honestly, if you're just looking for someone that you think you might be able to relate to, someone to follow. So yeah, without further ado, thank you all for watching. Appreciate y'all for tuning into the channel. Make sure y'all go watch some other videos while y'all are here on the platform. And I'll see y'all in the next video. Peace. I got baguettes in the back of my ring, and I went he trying to hit. I told her she gotta run to the team before she can talk to the lit. Before she can talk to the yeah. Round top, I just pulled up in some